In this submodule, we will focus on the biological and drug therapies. Drugs or medications or surgery are often used to alter brain functioning. This approach is based on the medical model of and the medical theories of psychology and of mental illness. The primary methods of treatment within this modality are psychotropic medications. These are drugs such as antidepressants, anti-anxiety medications, and antipsychotic medications. Specifically, antidepressant medications are those which oftentimes are based on the control of serotonin. One particular class of drugs are called SSRIs, as we see here. And the SSRIs stands for serotonin-specific reuptake inhibitors. SSRI, serotonin-specific reuptake inhibitors. And these basically prevent the reuptake of serotonin, which in a normal person, serotonin remains in the synaptic cleft, the gap, as it were, between one neuron and the next. So maybe this is the vesicle of a neuron, and these are all of the neurotransmitters, and this is the neurotransmitter that it's receiving. And when serotonin comes into the gap over here, in people who have depression, the theory is that there's a shortage of serotonin. So an SSRI comes in and basically blocks, in this area over here, a vacuum that normally would reuptake or vacuum back in the extra serotonin. And by blocking that, it basically leads to more serotonin staying and remaining in that gap for the next neuron to take in. Okay? It's a beautiful drawing. I'm sure it's very technically accurate, but hopefully you get the point. Anti-anxiety medications are those that reduce the arousal of the central nervous system, which is implicated in anxiety disorders. Oftentimes, SSRIs are also used for to treat anxiety, but there are also other forms of anxiety medications like benzodiazepines, or shorthand referred to as benzos, and each type of medication has its own upside and downside. Antipsychotic medications are those that focus primarily on dopamine, but not exclusively. The medications have a tremendous amount of side effects, very powerful drugs, and there's atypical and typical types of antipsychotic medications, atypical and typical forms of antipsychotic medications, but beyond that, you wouldn't really be responsible for knowing. In addition, within this domain of treatment, we find other techniques such as electroconvulsive therapy, ECT, which is these days only most exclusively used for people suffering from very severe depression. Very severe depression, and that depression which doesn't respond to the other medications that we've already spoken about. So it's almost like a last resort type of treatment where a person, electrodes are placed in a person's head in various points, protective measures are placed to control a person, and mild shocks to severe shocks are sent through the brain in order to, actually we don't even quite understand why ECT works, but it disrupts neural firings within the brain, and it can lead to an improvement in depressive symptomology. It has side effects of disrupting memory as well, but it is hopefully done in close supervision and checking for these side effects. Other types of biological treatments are deep brain stimulation. This is a relatively newer form of treatment where electrodes are placed, these small little electrodes are kind of surgically placed through the skull into parts of the brain, either temporarily or permanently, and low pulses of stimulation are sent in, and have an impact on the brain's functioning. And finally, psychosurgery is also a technique that's performed whereby, and this is not done much anymore, but lobotomies, whereby full portions of the brain are removed. Oftentimes they're parts of the brain that connected the upper regions to the lower regions, and by removing them, it was thought that symptom relief would occur. In reality, these surgeries led to reducing overall patient functioning. They're not widely used, if at all, today, but still historically worth noting. So that covers the biological and drug therapy section. We have a few more topics to go through, so we'll pick up on the next subtopic.